Intrauterine Insemination, or in short IUI. This is the topic of discussion in today's lecture. This is a medical procedure and this is required for many couples. If they are suffering from infertility problem. Though there are many types of solutions available. Okay, but this is most common procedure known as intrauterine insemination. Here what is done? Sperm is collected, okay, from the male partner or a donor, and then that sperm is directly placed into the uterus of the woman to conceive a child or for pregnancy. Okay, so this is the main procedure and this is the final stage. There are so many stages involved in such solution procedure to have pregnancy. Okay, so if couples or individuals are suffering from the problem of infertility, then in that case this is one kind of solution procedure, and I have already mentioned that this is most common, known as IUI or intrauterine insemination. There are so many potential barriers, and just by bypassing all those potential barriers to infertility, okay, the collected sperm is directly placed into the uterus of the woman. So there are so many stages involved in this procedure. Okay, the first stage is what? First is medical examination of both the partners, means both male and female partners. Okay, medical examination such as medical history reviews. Okay, then physical examination is there. Then certain tests are conducted, such as a blood test to assess the hormone levels. Okay, blood test of the woman is done to assess the hormone levels. Then ultrasonography or ultrascan, okay, ultrasound procedures or ultrasound scans are done to check the ovarian function of the female or the woman. Okay, then hysterosalpingography. This is one kind of procedure, testing procedure. By following this procedure, whether the fallopian tubes are open or not, that is checked. Okay, so these are the first step. And one more thing, for male partner there is one test. Sperm is checked. Okay, the motility of the sperm, the health of the sperm, okay, sperm count. So these are checked. Okay, this is for the male. Next step is what is required during the procedure. Ovulation means eggs are required. So to evaluate the ovary means to stimulate the ovulation process, medications are prescribed. Okay, clomiphene citrate, this is one kind of medication. This is oral agent. This may be administered. Again, injection such as gonadotropin may be administered to the woman. Okay, ovary. This is the body part of woman. This is known to you. So this is what? This is one kind of ovarian stimulation. So that during the final procedure, means when the insemination will be done, on that day, sufficient number of eggs should be available. Okay, so to stimulate that procedure, these medications are prescribed or administered to the woman. Okay, then monitoring is required through blood test, through ultrasonography test. Monitoring is required, and next step is again HCG hormone. HCG means human chorionic gonadotropin hormone. This is also required, may be required. Not for all the cases it is required for, but may be required, and that will be decided by your doctor. Okay, so HCG is also administered. Okay, when the follicles are mature, in that case this is required. Okay, so again next step is sperm collection. That is again one step. Sperm is collected from the male partner or if male partner is not available, then in that case a donor is required. So from the donor, sperm is collected and then that sperm is washed. That procedure is known as sperm washing. The debris, seminal fluid, non-motile sperm, those are removed, and only the healthy sperm or the motile sperm are collected. Okay, and those collected sperm, means motile sperm, that sperm will be inseminated into the uterus of the woman. And this procedure is done on the final day, means the day on which the insemination will be done. On that day this is, okay, sperm is collected and washed. Then the final stage means insemination. Insemination, this is a non-invasive or less invasive procedure. Okay, much pain is not involved. Okay, maybe there is a light discomfort or pain may be felt by a few women, not for all women this is applicable. Okay, this type of discomfort or cramping. Okay, right? And then so what is done, I have already mentioned that that collected sperm is inseminated through the cervix. Okay, a thin catheter is used to execute this process. A thin catheter. Okay, that is inserted through the cervix, and the sperm is placed into the uterus. After that, some rest for a short time. Rest is required for the woman, and then the woman can restore her normal activities. Okay. And after this procedure of insemination, progesterone hormone, means this type of medication may be administered to the woman to support the uterus lining and for the proper implantation of the egg. That is the purpose. So in each case medications are involved, but that will be decided by the doctor. Okay. Not in all the cases all types of medications must be prescribed to the woman. That is not the case. Okay. That will be decided by the doctor. Doctor will decide depending upon many things. They are able to decide whether you are required or not. It is required or not for you. Okay. So after insemination, monitoring is done, and 2 weeks after the insemination, pregnancy test is done whether the woman has become pregnant or not. Okay, and success rate for this is very less. It is only 10 to 20%. But if you repeat the cycle many times, okay, as and when required, and that will be asked by your doctor. Okay, that will be told by your doctor. So maybe more than one cycle is required. So if per cycle the success rate is 10 to 20%. And doctors always will check the previous result or outcome, okay, of the patient or the woman. And depending upon all those things, they will, means doctors will decide what to do the next. Anyway, more than one cycle may be required to get pregnancy. Means to get successful pregnancy. Okay. So pregnancy test is done normally 2 weeks after the insemination procedure. Okay. Anyway, this is most popular procedure, IUI or intrauterine insemination. Though per cycle success rate is less, only 10 to 20%, but if you decide to get pregnant by using this procedure, then I think in most of the cases women actually get success. Okay, many cycles may be required for your case. Okay, anyway, so this was all about the topic intrauterine insemination. Okay, and this is less costly, less expensive. Okay, this is less expensive as compared to IVF, means in vitro fertilization. Okay, where the fertilization actually is done in the laboratory, and that is quite expensive, in vitro fertilization or IVF. But IUI, this is less expensive. Okay. Anyway, so this was all about today's topic, IUI or intrauterine insemination. Okay. So this is the end of this video. Thank you. Thank you for watching this video.